This is Chadi Alraies from New Orleans, and this is NCVH 2023. I'm really privileged today to be with Dr. George Chrysant. He is a peripheral interventionist as well as cardiologist, and we're going to talk today briefly about how NCVH is unique in terms of PVD therapy and innovation. George, thanks for being with us.
Oh yeah, thank you. So this is one of my favorite meetings because it really is focused on peripheral arterial disease from the prevention standpoint, treatment standpoint, economic standpoint, and the burden on society. And really, I think Dr. Walker has always had an eye on not just peripheral arterial disease, but all of the innovation too. And I think as the landscape has become so crowded with all these devices, I think that one of the strengths of this meeting is being able to demonstrate the utility of these devices and the disease state, because it can get very confusing. Absolutely. In terms of all of the different products for thrombus removal, all of the different balloons and stents and atherectomy devices. And so the quality of the cases this morning were very, very high. It was excellent. But I really think that's the strength of the meeting.
And I can assure that when you trained George was completely different. I'm not saying, absolutely, I'm not judging the name, but just saying the innovation is so fast and the market is exploding. So what we trained on 3 years ago, 4 years ago is completely different toolbox now. Yeah. So this is a nice venue to learn all these things.
Absolutely. I mean, I'm not afraid to say it. I mean, I got out in 2004. I mean, the landscape was almost barren. But you bring up a good point. You could have gotten out of fellowship 3 years ago and look around and go, what is going on here? And it was just 3 years ago. So
because especially you are familiar with the certain toolbox that you use.
Absolutely.
But definitely when you come here, you see, oh, I can do it a different way. And this is the venue for it.
Oh yeah, the wires, the crossing catheters. Yeah. There's so much just stuff out there.
So now I'm going to ask you a more challenging question now. There's different setups here, right? People are private practice, they have an OBL, they are academics and university-based or hospital-based, like myself, I'm employed by a hospital. So what are the challenges of bringing these technologies to the practice?
So it has to do with CV service line and supply chain stuff, and that's different if you're in an outpatient lab or a hospital system or an academic system. So academic systems obviously have a certain advantage in the sense that because they're training institutions, they kind of have more leeway to have a broader array of devices versus someone in an office-based lab or an ambulatory surgical center where cost is paramount, so they kind of have to trim it down. Yes. And then I'm kind of in an in-between situation. I actually am in charge of supply chain for the cardiovascular service line. And so we evaluate things in terms of what each company can bring to us in terms of a whole package. Yes. And how that can help us from an economic standpoint. But yeah, that's another thing that I think is talked about here and not so much at other meetings. And, exactly. And there's a practicality to it because you may see something here and think it's really great, and then you get back home and you find out that we don't use that or we can't get that. Yeah, and so it's that part I imagine would be very discouraging. Yeah. So you're right, it's a difficult tightrope to walk.
But this is one of the skills you teach the fellows and the people are coming to practice, that if they have a champion, kind of lead that, show the value of this device. Yeah. And also all technology, whatever it is, I think there's a room for that.
Yeah, absolutely.
Well, George, thank you so much for your time. Really appreciate you. Thank you.
Good to see you as always.
Please watch these videos and others on NCVH YouTube channel. This is Chadi Alraies from New Orleans. George, thanks again.
Thank you.
Awesome.